I'm Sheila. I'm a special educator at Arcadia and Ivers, and I handle home science as a subject. And this is my friend MANASVINI. She is also a special educator and she handles psychology at Arcadia and Ivers. Hello, MANASVINI. Nice to
Hello.
have you.
Yes.
We are going to deal about the most important issue among adolescents at present. And no, we have come here to just enlighten you with some points, no, which you as parents or teachers should be aware when they are looking at their wards or children. Yes, Manaswini.
Absolutely. So, in today's world, mental health is something that is a cause of concern for all of us, especially adolescents, because we are very frequently reading news about adolescent suicide, which is what we're going to be talking about at length today. So, ma'am, when you're looking at adolescent suicides, right, there is a lot of causes that trigger such a very drastic uh, action. So, in your perspective, what do you think pushes adolescents to take such drastic measures?
There are various reasons why children take to this drastic step. One can be academic pressure, the next is peer pressure, maybe no they do not have good friends, or no sometimes they just want to show that no they are going to take a drastic step, and it may lead to a serious attempt also at times. And academic pressure can be dealt with understanding teachers and the school. And no the peer pressure again no is plays a very important role in no children taking these kind of drastic steps. As peers no they are lost because they do not have friends. Some people, they do not have friends, they cannot be part of a group, and no that no leads them into depression. And no that it's a very thin line where no they don't want to no live anymore because of no not getting friends. And no they take this drastic step. So that is no peer pressure. And no when peers or the children get back to their house and tell their parents, the parents are not bothered. They feel no it is a no common thing, and no you they say, oh it's fine, you just have to go and no talk to them, doesn't matter, or go and tell the teacher, and there ends the matter with the parents. So the child even feels even more depressed, because the child feels that they are not loved at home, they are not taken care of at school and by the friends, and so they want to end their lives. So that is how these kind of thoughts come into their mind. And no it leads to a drastic step, and the life is gone. If only the parents and the teachers or the peers take a little bit of no extra care with this individual, no the life could be saved.
Absolutely, I agree. And when we're looking at suicide, it is never just a decision that one makes overnight. It's not something that I wake up and decide to do. There is always an underlying cause that pushes an individual to think of such a bold step. So when you did highlight, peer pressure that could trigger depression or anxiety, and an overdue of depression, anxiety, stress, the child invariably reaches a point where he or she is not able to accept that kind of stress anymore. And adolescent also happens to be a very precarious stage, right? This is the stage where an individual understands who they are. The question of who their identity, what their identity is, who they are, what their sense of self is, who they are surrounding themselves with, the kind of peers, the kind of exposure that they get. And in terms of exposure and information, there is so much out there in today's world. It's not like how it used to be 3 4 generations
There's
ago.
a go.
So at the click of one button I can get all the information I need, but unfortunately the information that they have, they are not able to process it in the right way. There is too much of information out there, but there is too little of processing of that information, which is pushing them to a place where they are confused ultimately, and they have no outlet of understanding that for
For
themselves,
themselves.
right? Which pushes them to such drastic
Drastic
measures.
measures.
And when we're looking at influence, right, in your opinion, again, what do you think is an important influence
The
for
peers play a
their
very
mental health?
important role in influencing the individual, especially when no they want to make friends with the opposite sex, so no opposite gender. Then they no and no one cares or no one wants to speak to that person. Then they no feel that no I'm not having a friend like my other friend. So then they what they do is they want to just no end their lives, or they want to just take some drastic step just to show or seek attention from the opposite sex. And this is what happens many a times. This is what happens, and when they are getting into a shell, they become an introvert. They get into a shell. They don't want to talk to anyone, may it be their own friends in school or their parents. They just go and themselves inside a room. That's when it's a cause for concern. And no, as parents we have to look out for these signs, so that we keep no talking to these children more like a friend than a parent. Because adolescents, they feel that once no they are into the teenage, no they want their freedom, and they want to do things for themselves, and they want to take decisions for themselves. Where parents, till no the beginning of adolescence, they were no telling what to do and what not to do. But now as adolescents, they want to have their own say, and they want to do things on their own. But the parents still keep no authoritative over the child, and that puts them off. And they want to no go on this sly and do things which no the peers are doing, the friends, peer pressure, because no they want to be part of the group. They indulge in all kinds of activities like no, smoking, drinking, alcohol, drugs. No, they are pressurized to do that, to just to be the part of that gang. So all this no when the child gets into it, it becomes habitual. So adolescence is a very no crucial stage, where parents, teachers and peers play a very important role in no molding the adolescent.
Absolutely. Like how there is peer pressure, there is also pressure from parental side, either too much of it or a lack of it. A lot of parents these days tend, adolescence is, again, like you said, it's the rebel phase, right?
Yes.
So the parents also can only take so much of the rebelling, and you tend to let go of the child beyond a certain point where they feel like you are not associating with them anymore. This sort of a gap that comes between the child and the parents. This also could be an influence for the child to totally detach from the parents and to think that as an individual, as an adolescent, as somebody who's 17 or 18 years of age, they are old enough to be making decisions without any sort of supervision, which we know is not definitely true, right? There is some sort of supervision that definitely needs to be done. But again, that's sort of a love hate relationship that goes on with the parents. One
Parents.
day we need the parents, one day we don't want them around. But as parents, science, even as educators, it's important to look out for very unique characteristics that people who are experiencing an imbalance in mental health. You have to look out for signs of detachment. From a teacher's perspective, I would encourage fellow teachers to look out
To
for the
look out.
behavior of the child,
Child.
because as teachers we spend the most time with these children,
Children.
so we do tend to understand who they are as people and how they react and what their general responses would be. So are you seeing any sort of a change or a mismatch in this person's behavior, in their usual responses? Are they being regular to their activities? Are you seeing irregularities there? From the perspective of parents, from a household perspective, do you see your child being detached from you all of a sudden, or any irregularities in sleep patterns or eating patterns? Because, like we mentioned, a lot of these could be triggered by either anxiety or depression, for which the child could be getting medicated for. So, these medications that we take, anti anxiety medication, antidepressants, they all have a secondary effect on the body, which could result in poor sleep, poor appetite. But apart from that, are you seeing anything abnormal going on with the child? All of this raises as red flags when we're dealing with children who are fighting any sort of mental illness. Right?
Yes, exactly. And no parents, when they feel that the child no is no going out of hand, or no they are not no behaving as they as normally do, then it's a cause for concern for the parents, and it is a signal that they should get external help. Apart from the teachers or this peer group, they should get no medical advice from the proper psychologist or psychiatrist. No, many of these parents and the child have a stigma that if they go to a psychologist, that they are branded as mentals. Okay, but then when no, it is just like when we are ailing with a fever or no some other disease, we go to a doctor, we get a second opinion. So it's like that. No, when we teachers and parents can help no these children to come out of that, but then the medical help is always required for some children, which will no sober them down. They can sleep well and they can get out of it with proper counseling. But many parents no feel that they don't need counseling. That's where the mistake lies. And there are so many institutions no, which help these kind of children when they have these thoughts coming in continuously. So they have to seek help, medical help.
Absolutely, I agree. Destigmatizing the concept of mental health itself is a big step that we need to be taking. There is, like ma'am said, a lot of stigma that is associated with mental health. The term itself sends a very negative connotation to a lot of us. Right? That is only because of the conditioning that we have been raised with. We don't associate that in a positive way. So, for us to come out of that circle and to understand what a child needs is very important. But also as parents and educators, from an educational perspective, it's been made mandatory for all the schools to have counselors in place. So when you see a child in your class who you feel may need some sort of an intervention, there is something off that you think that needs a little bit of attention, make sure that the counselor is alerted, make sure that the parents are alerted, keep a watchful eye for all of these symptoms, right? It could be seasonal, it could be a temporary thing, it could be triggered from anything. So these days problems could be anything. They are also at a stage where even the smallest of inconvenience is considered a very, very major life change for adolescents. That's just how they see it.
See it.
So, we as educators need to always be on the lookout for their mental health and not their physical health alone. And also, as parents, I feel a lot of the parents need counseling
Counseling
themselves
themselves.
for them to understand, the contemporary adolescent problems that are existing, what they as parents should be aware of, and how to deal with this if it comes up. Right. So, when we're talking about contemporary mental health issues, what do you think are existing among children of these days?
Maybe no, they are no most of them they want to perform, but they're not able to perform in schools. And comparison between the siblings and the school children themselves, when they can do, why can't you do?
Right.
And at home, no, when the older one is sitting and studying, why are you not sitting and studying? And the mobile phones in today's world has ruined the academic pattern of the children at home and at school. No, they are not allowed to bring the mobile phones, but in spite of that they bring, and they use it in classes during classes. And no, even when it is monitored, the no, sometimes the parents come to the rescue of the children.
Right.
So no, that's where no, we teachers face a problem. No, we are not able to correct or discipline the child because the parents side the children. So in that case we are lost. So no, these kind of no, mental health is very, very essential. That is why we see that no, these children should have some kind of healthy relationship with the no, opposite gender, as well as the no, girls or boys, whoever it is. So that is very, very essential, and this mental health can happen only with proper surroundings at home. No, many of these families are having a lot of issues between the father and the mother. So that also can be a problem for these children, where they don't want to no, come and reveal it, or they don't want to show it or share it with their friends. And when they especially when the parents are no, separated, or no, they have some kind of issues no, within themselves, that reflects on the child. No, the child comes to school, and no, the child keeps to himself or herself, because he or she does not want to no, say what is happening at home. So all these are that leads to thoughts which is coming into them over and over again, because they compare themselves to their peer groups. When they have a healthy family relationship, these children are not able to afford such relationship. So that's when they no, also feel, no, where am I? Why am I like this? Why is it happening only to me? All these questions keep arising to them, and they don't find an answer.
Absolutely. There are a lot of questioning that goes on, and like you said, a lot of compare and contrast that goes
Goes
on,
on.
right? There could be family trouble, it could be trouble even between friends.
Friends.
That's also an age where they think, adolescents are bound to think that their friendships are long lasting, it's going to be everlasting. So, the smallest of an argument with a friend could potentially send one of the two into a world, right? And where they're not able to come out of that by themselves, where they need the intervention of an adult
And
or a teacher. So uh, it again draws back to how adolescence is a very, very fragile state,
stage, yes,
especially with
definitely.
puberty that's happening and hormones going
Hormones going,
all over. I feel like raising a child to be very confident, to speak their mind, to process their emotions,
emotions.
starting this at a very young stage is very important.
Yes,
Because as adolescents, they know, they realize that they have an outlet. They have somebody to go speak to about their
expected
problems. They can be vocal about their expressions.
expressions.
So that sort of builds some self confidence in them and gives them the positive reinforcement to deal with their
Deal with
negative
it.
problems.
Problems.
So it needs to start from a very young age and not waiting for the right age to educate your child about being vocal or expressing their inconveniences, or having to seek help if there is something wrong that needs to be addressed. What other ways do you think we could battle this problem?
Um, the other ways are, we have maintaining a healthy relationship with the peer group. And if there is a problem or a rift between friends, it is up to the teachers to solve that problem there. So rather than the child taking it back home and the parents getting involved. So it is better for us to also talk to them about some values in life, in day-to-day lives. Earlier we had something called as no moral science or value education in schools, but all that has vanished because of the academic pressure which is causing them a lot of stress. So these kind of extracurricular activities, co-curricular activities, a group activity, all this will help in strengthening their relationship with each other. That is very, very essential. And as teachers, we have to we need not be strict all the time. We have to empathize with them, be in their shoes, and try to help them out rather than scolding and reprimanding them. Nowadays we don't have corporal punishments, but in spite of that, no, we have to go a step ahead, apart from the monotonous teaching and finishing the portions and writing the tests. That is not necessary. A good behavior and a good healthy, mentally healthy and physically healthy child is what is more important. No, many suicides can be no prevented if only that extra bit of no helping hand had been given to that child, spoken to that child, or no, maybe the parents could have no taken a lot of help. So no, we could have prevented a lot of no such cases.
True, a lot of teenage suicides are being attributed to educational academic pressure, where they're not able to perform, like
Perform.
you said, or it could be problems from the personal front, or it's usually drugs. These, keep coming back in circulation as
Circulation.
major triggers that could cause drastic action. But as from educational institutions, it is important that the children, personally, I feel that especially children of this generation, they should be sensitized on a monthly basis on mental health
Mental
alone.
health.
Just somebody telling them what is what you're experiencing is okay, what you're
Hmm.
experiencing is something other people have experienced. Just that reassurance.
Reassurance,
Even
yes.
if they are not in the space to be vocal about their problems, at least they know they're processing that there is somebody out there for them to speak to,
Speak to.
and they understand what is going on with their body as well. So many other changes which are associated. What is the cause of anxiety for them? What is the cause of depression for them? Right, who they are as people, and when they have such questions coming up, and somebody comes to answer these questions, which usually is not
Not
answered.
answered.
Right, this is not a part of the academic
Academic
curriculum.
curriculum. Mhm.
So which I think should be made mandatory, where students get an avenue to talk about their problems right from a very young age. Right, we are right now battling introducing sex education to students. While we are also doing that, I think mental health education is also very, very important,
Important.
especially for adolescents,
Adolescents.
where that becomes a very rocky stage. Somebody needs to be educating them, somebody needs to be there to masquerade as a friend as well as an educator for them to have an open and a free space
Space.
with.
Oh.
Right. And even like you said, as parents, it's important that they create a safe space in the household also, where typically they're not shamed, especially adolescent boys
Adolescent.
are not, shamed for crying, or
Hmm.
where adolescent
Yes.
girls are not shamed for crying too much, right?
Mhm.
So things like this, where parents are spending a little more time engaging with their children, creates such a difference for the child. A lot of them experience a detachment from their parents only because they don't have the time for each other. right? While one is busy off to school and tuition and other
Activities,
extracurricular activities, parents, are busy in their lives with work,
making money work.
right? There is no quality time that is spent between both parties, and I feel that could bring about such a change. While parents are the first line of support for a lot of the children, so when this sort of an environment is created for the child, it definitely creates a change.
We at Arcadia also do a lot of counseling for the students and the parents as well, and we know we as a joint effort, we are bringing up children at Arcadia, and apart from the academics, we also get into their individual lives and know, try to educate them as to how to be mentally strong and know, cope with the stresses in life.
We at Arcadia also foster positive spaces, and we create safe spaces for the children to express themselves, and be it a minor or a major inconvenience. It is important that we put the students' mental health prior their academic excellence.